Hi everyone, I'm Dr. Vincent Wong and welcome to Trivian Aesthetics in the heart of London. Today we'll be looking at how to perform an exosome treatment using XOMAGE. So this product is from Zeshao and it contains 10 billion exosome particles in one vial. So it's an amazing product, very easy to use. Let's see how it's done.
Hi, I'm Federica, I'm 44 years old, I'm a fitness coach and personal trainer and a mum. Well, I had a few treatments in the past, injectable treatments, but they never really seemed to help with pore size, skin quality in general, redness, pigmentation, especially after pregnancy. I've been seeing my skin changing in parts and I don't see that ever improving. To hide these imperfections, I wear makeup all the time. Generally I use filters on my phone and it really does impact my confidence because I pretty much can't leave the house without putting makeup on. I don't like seeing myself in photos because I always look at lots of red, pores, and it's just not nice.
So first we start off with a 3D analysis of the face. Here's everything you need for the treatment. So your gloves, your syringes, needles, and of course the multi-pin needle for the injection and the product. So look at this. So the first step is to draw 5 mils of normal saline. So 5 mils will allow us to treat the full face and neck. Otherwise, you can also use 3 ml of saline just to treat the face. So we have our 5 ml of saline and the product. So now we're going to mix them together. So very slowly. Now that we have put the saline in, so let's mix them together. Very, very gently like this. A little bit like this, until we get a very clear solution. So with this model today, we have already applied topical anesthetics. So I use 5% amyloid cream for about 30 minutes. And now we're going to divide the face and neck into different zones. So here we draw a midline all the way down. And then from the alar base to the triggers on both sides. Okay, so for this quadrant I'll be using 1 mil, this quadrant will be using 1 mil, and then this quadrant will be 1 mil, and then this quadrant will be 1 mil. And then the remaining 1 mil I'll be using in the neck region. Before we begin, I'm just going to clean the face again with antiseptic solution. Okay, so here we have a 1 mil syringe with the exosome in it connected to a 9-pin needle. Okay, so this needle is unique in the sense that you can actually control the length of the needle according to the patient's sensitivity and how deep you want to be. Okay, so it goes very long to very short. Okay, so we're going to use a shorter one for the forehead and eye region, and a slightly longer one for the mid and lower face. So we're just injecting the product very slightly and massaging it in. As you can see, there's no bleeding. It's a very comfortable procedure for the patient. So we're just creating micro trauma with the needle, and then we are just injecting product into it and massaging it back into it. So here we're using a very short needle just to help the treatment become more tolerable because this area is a little bit more sensitive. Okay, so you can pull the eyelid down and go right under the eyelid. Okay, just massage your product in. Okay, you can treat the nose as well. Remembering our marking. So that's 1 ml for 1 quadrant of the face. So now we're adjusting the length of the needle to slightly longer so that it can penetrate deeper into the skin. Okay, and again the same thing, so we start from here. So now we're treating the neck area. So again, we're using a shorter needle because this area is slightly more delicate.
So the treatment was just a little prickly, not painful at all, very comfortable, and Dr. Vincent said it's the most effective and safest exosome treatment available. And I'm really looking forward to do it again. I cannot believe how much my skin has improved since having the treatment. Skin quality is 100 times better than what it used to be. Things like using a primer to close my pores, I don't need to do that anymore because pores are closed. I had quite a big patch of pigmentation here after pregnancy, and that is virtually like all gone. There's only a tiny little bit left, and I'm sure it's gonna go soon. My skin feels always very luminous and plump and smooth. I'm not getting breakouts as much, almost nothing. It's just so unbelievably good.